transparency on the vaccine. One of the problems is the way he's playing with politics. He's said so many things that aren't true. I'm worried if we do have a really good vaccine, people are going to be reluctant to take it. And so he's undermining public confidence.
Contrary to all of the lies, the vaccine, that they're politicalized. They'll say anything. And it's so dangerous for our country what they say. But the vaccine will be very safe and very effective, and it'll be delivered very soon.
Putting politics aside, if we do get a vaccine before Election Day, how safe will it be? Johns Hopkins University School of Medicine's Dr. Anita Gupta joins me now. Dr. Gupta, I want to alert the audience that the major players in this race for a vaccine have all put out a press release vowing that they would adhere to high scientific ethics and standards when it comes to this vaccine and the manufacturing of it. So Pfizer, Johnson & Johnson, Sanofi, and Moderna all trying to let the public know, hey, when we get to the finish line, we'll get there the right way.
Right. And look, and just to step back, I mean, this is a high science process. Distributing, developing a COVID-19 vaccine or any vaccine is always high science. And it's one of the most challenging public health initiatives ever attempted. And so we have to keep that in mind. This is not a political process. It is a public health process, and it is one at a global level. So we have to get to 300 million Americans, and we have to get around the world, and we may have to do that multiple times. So it is a long, arduous process that requires not only the U.S. Food and Drug Administration, but global regulators from around the world. So it is a massive, massive process.
So then how concerned are you? I was really surprised when I heard Vice Presidential nominee Kamala Harris suggest that she would not take a vaccine. There are enough people out there who aren't going to take it anyway. Many people don't want to be the first to take it if they eventually do take it. I mean, it's got its own issues to begin with, but certainly how concerned are you about the politicalization that this is even being brought up in politics when it's a medical issue?
Look, we have to go back to the data. There is due process when we look at any drug product or vaccine. How safe is it? How effective is it? And, as a scientist and as a physician, I'll look at the data. I'll want to look at the evidence and make sure that it is effective. And I think that's what we have to look at and leave it to the scientists to let them do their work. We're looking at the process very transparently right now, and I know that's sometimes difficult to see, but ultimately, the companies that are working on it, they're doing what they need to do, and it's never too early to begin action when we're dealing with a massive global pandemic.
Absolutely. Well, I want to switch gears a little bit. Labor Day gatherings raising some concerns about a potential rise in cases as we head into the fall. Will the holiday and a lot of these big gatherings mean more COVID-19 hotspots in the weeks to come? Certainly,
there is certain concern about this, and we've heard all the precautions. Prevention is utmost concern here, and certainly there is a period that we have to wait and see. A 2-week period here that we'll have to wait and see what happened from this weekend. But there's certain concern amongst experts, including myself, of what will happen. There's certainly need for social distancing that has to continue, wearing masks, and, certainly the hand washing. And we should not compromise that, whether there's a holiday or not, and continue to remain safe and follow all the precautions put forward by all the experts and our communities.
It does seem intriguing, though, because we've seen large gatherings. I look at Sturgis, for instance. I know a lot of folks are watching that. And while there have been some cases, it's not coming near the hype or the fear factor. Is there something going on where, that's mitigating the spread of these, of the coronavirus out of these big events where, there is no social distancing per se? What's happening there?
Well, look, I think individuals are tired. There's definitely an exhaustion factor, and individuals want to be outside. They want to break free from that. But we have to remember there's still individuals that are seriously ill. They're hospitalized, and there is a major global pandemic. And in order to end that, we will have to continue to follow all precautions.
Dr. Gupta, thank you very much. We always appreciate it.